before we start, the events that have occurred over the last few weeks and the last few months in the UK and also in the US have shone a spotlight on several things. Firstly, the significant health and social inequalities and the discrimination that exist both in our country and in other countries across the world. The second thing that it has really highlighted, and the COVID crisis in particular, is the critical role that digital and technology play in helping us to deliver safe patient services to our patients and our service users, and also supporting our staff to do their jobs under extraordinarily difficult situations. But it has also highlighted the risk of a digital divide and exclusion. So I am delighted that our speakers today are women who are doing active work around reducing the digital divide, improving access to services, and improving digital literacy. Now, just 2 minutes about the Shuri Network, and I hope that you will all join the Shuri Network at the end of the webinar. We are the first network for BME women and allies in health and social care who are interested in technology and how this can help us deliver safe patient care. We were launched last year in July, and we are growing to over 500 members from across the UK, including nurses, data analysts, therapists, and doctors. And we all use technology every day to look after our patients and service users. But the people who are leading digital change and the people who are designing tools and apps very often don't resemble frontline staff. So we want to address this imbalance. We want to demystify what it is to have a digital health career. We offer practical support like this event to showcase successful role models who are BME women, and to encourage women to take their first steps into becoming a digital innovator. Because the NHS is really losing out on talented people, energy, ideas, and innovation if we don't include everyone on our digital transformation journey. So please do join through our website, which is www.shurinetwork.com. That's enough from me. I'm going to introduce our wonderful panel now. And first of all, we have Sara Nelson, who is the Program Director of Digital Health London's Accelerator program, which is now open for applications. And Sarah is going to tell us more about the Accelerator program in a moment. Our second speaker is Rajal Patni, who is an alumnus of the Accelerator program. Rajal is co-founder and Chief Finance Officer of Lavanya Plus. She has an incredible track record of working in finance. And in 2016, she took the leap into the health and care sector because she had problems and poor experiences coordinating care for her father, who was unwell at the time. So Lavanya Plus was founded with her family, and its aim is to improve access to and outcomes in social care services. Rajal is also an angel investor and has mentored many entrepreneurs and startups. Our third speaker today is Saira Arif, who is an implementation manager for ORCHA. Saira is also co-founder for Project DESI, which I'm sure she'll tell us about. Saira has a legal background, and before joining ORCHA was the Digital Citizen and Innovation Program Manager in Northwest London. And she is passionate about increasing digital literacy and empowering the public to engage with digital tools and digital transformation. Saira will also tell us about her experience on the NHS Digital Pioneer Fellowship Program and how to take your first steps of being a digital innovator. So let's kick off, and I'm going to hand over to Sara Nelson. Over to you, Sara.
I'm Shera Nelson, and I'm the Programme Director of the Accelerator programme and an NHS nurse with over 25 years of service. I'm immensely proud of the impact and the transformation that so many of our companies and the NHS organisations we have worked with over the past 5 years have achieved. At Digital Health.London, we believe that diversity and inclusion is at the centre of the long-term success of innovation and transformation of the NHS. We're pleased that of the companies that we've supported to date, 22% are BAME founded or majority founded organisations. 20% are women majority or equal men-women ownership, and 1.7% are partly or majority owned by a person with a disability. We're committed to supporting this diversity, and we're currently open for applications for our next cohort of innovations. And we would welcome applications from women, people with disabilities, and BAME groups, all of whom are currently underrepresented in this sector. We're delighted to be working with the Shuri Network, and I originally signed up as an ally after the launch of the Digital Health Summer School last year. I hope this network continues to encourage many more women of Black and ethnic minorities to see digital healthcare as a career option, and together we can support them to become leaders within it. We are open for applications for the 2021 Accelerator programme and are looking for the next generation of digital health innovations that can support our NHS and help our patients to better manage their health. I'm really looking forward to hearing from Saira and Rajal today, two ladies of whom I've come to know over the past 2 years and who are great and inspiring role models and lovely people with that. Thank you, and back to Shera.
Thank you so much, Sarah, and really good to hear about the Accelerator program. Rajal, welcome to our webinar. Now, Rajal, I read a report done by MIT recently about female founders and the challenges that female founders and entrepreneurs face. And the study showed that even with the same pitch, men were much more likely to get funding for their projects and programs than women, which is really shocking to me. So Rajal, it will be fantastic to hear about your experience as a female founder and entrepreneur, your journey, how you set up Lavanya Plus, and how the Accelerator program has really helped you. So Rajal, over to you.
Great. Thank you, guys, and thank you for having me on the webinar to share my story. I think if I start from my grassroots, you know, I began my journey in East Africa. I was second generation Indian born in a town called Uganda. And in August 1972, with Idi Amin's ordered expulsions of the Asian community out of Uganda, our family emigrated into the UK. So for my journey, that's really where it began. You know, I was 7 when I came into the UK and, you know, started to settle into the education system here, into the diverse culture system here, and essentially went through all of my education through to degree level here. I actually did chemistry. I'm not sure why, but I did. But, you know, I have a great love of numbers, and I got married young, and I had my firstborn young, quite young as well. But because I had my love of numbers, I felt that I needed to get into finance and accounting. And at that time, my husband had started his first venture. So in a way, it gave me a lot around how to set up a business, how to navigate, you know, just basics of, you know, what do I need from the facts of having a, I don't know, essentially a table and a desk, you know, getting myself started with a new business, trying to work with new customers, to then trying to raise money. You know, as I then progressed through my career, we were exposed a lot in different industries. So I ended up learning a lot of different cultures within different businesses. I worked in construction, I worked in payments, I worked in technology, and, you know, being a finance director, you're sort of in the grassroots of everything, and how the business needs to function inwardly as well as outwardly. So I had a huge exposure in that, which really set my own personal development. I would say that I'm an individual that's quite curious, and I love to, you know, learn around new things. You know, 20 years into my working career, and my father was sort of hitting around 60s and his 70s, and my family's health was then becoming a bit more of a priority around my work as well, which is really where I then ended up becoming you know, a first carer for my father. And at that point, really, I actually got to understand how the digital health, you know, digital health lack sector there is, because, you know, every bit of information that I would have, I'd have to have it on paper. You know, if I'm going to a GP, or if I'm going to a hospital, and my father and our family would travel abroad to India. So, you know, there was an occasion where my father was very ill in India, and we had to bring him back into the UK. So different sectors, different systems, and it just was very, very painful for us in trying to navigate how we are actually looking after him. And that's really where our business thoughts were then developed. That's really how we sort of believe that, you know, bringing together our skills around digital technology, around making sure that there is some way of communication, a particular platform. And that's how we felt that having, you know, our web and mobile sort of care concierge service with a sort of a combined marketplace should actually help users that need this type of service to navigate information that they may need and support that they may need. That's really how I started off my journey into this area. And as has been mentioned, you know, in 2016, we basically took the leap that, you know, we need to have this idea and concept, you know, turn it into reality. And that's really how we began our business. And we came across, and after the first year of building our technology platform, doing a lot of research, because this was a sector that we didn't understand. So before we sort of took the dive, it was very important for us to talk to lots of advisors, lots of our friends, understand, you know, the positives and negatives about, you know, navigating the care and the social care system, health system, you know, with all different professionals, from doctors to pharmacists, and, you know, nurses, and, you know, people in social care homes. So there was a lot of research and conversations that we ended up having, and we sort of built our very first platform. But then we felt that, you know, we needed more, because we needed to get into public health, you know, into understanding the basics of how the system actually works. Because as an individual, as my father, if I need to do anything for him, he had to go initially first to the GP. And then there was a referral system, which then either took him to hospitals or took him into other various areas within the NHS. And that's when we actually came across DigitalHealth.London, the Accelerator program. And we felt that it would give us, you know, to make the application, to give us a basis of understanding how to navigate the system within which we all live in today. So it was quite important for us to do that. And we were super excited that we got, you know, selected as a cohort that looks to see how, you know, within the core, that looks to see how healthcare system and the social care system can somehow connect. Because it is vital that when you come out of NHS, you know, you're then going into a social community care sector, and there seems to be a huge gap, and there seems to be elements within that you don't always get information that's connected. You know, you sort of have to repeat yourself as to what's happened, what hasn't happened. And, you know, we we basically worked with Sara and her team when we were on the Accelerator program to understand really three key things. You know, how do we address and build the knowledge within the public sector of how health and social care can actually be connected digitally, and look at ways of looking at, you know, making things easier for individuals. And then we also wanted to gain a lot of knowledge around the public sector and how it works, you know, of course, for us in London. And then also we wanted to ensure that how do we then enhance this proposition to then get it to go to market. And the Accelerator program really helped us nurture our ideas, build and solidify our ideas. Really, then it came down to, you know, how do we then scale this up? I think, you know, you touched around, you know, funding, you know, going out to the market for funding. So we ourselves have invested funding. There's a lot of conversations I've had with the banks, and, you know, there's a lot of conversations that we have in our own network to try to raise seed round funding. And that's really at the stage that we're at right now. And, you know, we touched on the COVID crisis. You know, where we are today has really accelerated the adoption and the importance of digital. I think, you know, I personally feel that when we were looking at this proposition and our solution nearly 2.5-3 years ago, you know, the adoption and was, you know, there was a lot of barriers that we would face. But today, given the pandemic, you know, suddenly the adoption of digital and solutions around digital, with the government providing huge amounts of funding into it, and you know, UK Innovate also creating funds with government support, you know, is now giving us a better forum to actually get our products and get our solutions out into the market. I hope that gives you a little bit of a flavor. I don't know what else I can sort of share within my journey.
Rajal, thank you so much. I found that incredibly inspiring and moving, particularly when you talked about the gap between health and social care and how that's having a real impact on patients' experiences. It causes huge amounts of stress to service users, to their families and their carers. And how do we, in this new world post-COVID, how do we reduce that gap and reduce digital exclusion?
Yes.
Improve access and integrate services. We've talked about this for years.
Yes.
It feels like we really have to push this agenda forward and put it at the heart of all our digital transformation programs.
Yes.
So thank you. I'm sure you'll get lots of questions from our audience.
No, pleasure.
Our next speaker is Saira. And I suppose a question, Saira, that we'd like you to explore is, if you aren't further along in your digital career as perhaps Rajal and her family were, if you're just starting off and dipping your toe into digital technology and innovation, you know, how do you take those first steps? If you've got a really good idea for improving services, improving access or inclusion, you know, what do you do? What support is out there? So we'd really like to hear about your journey and any advice you can give to future innovators and leaders. Thank you, Saira.
Thank you, Shera. So I think I'll start my journey by describing, I guess, where I come from. So I also come from a sort of East African, South Asian background. So from the very start, I've had a mix of values, mix of sort of, you know, a different type of ethos growing up. And visiting my mother's country from a very young age, you know, I saw a lot of poverty, a lot of injustices, a lot of sort of accessibility issues when it came to, you know, accessing certain systems, whether it's health or legal. And I think growing up, seeing that and experiencing that, it made me want to progress a career in law, which is, you know, why I decided to go into law and why I studied law. Became a lawyer because I really wanted to, I guess, contribute to that whole, you know, the value set that I had, you know, helping those that were vulnerable, engaging with people, understanding what the problem is. So I soon went into family law. That was sort of my speciality. And I sort of focused on domestic violence and sort of international adoption at the time. But just the reason I mentioned that is I want to show why I sort of transitioned into health and into sort of the NHS. The environment I was in, I enjoyed the work. I enjoyed everything that I was doing because, again, it matched my value set. But it wasn't the environment I wanted to be in. Firstly, I didn't feel supported as much as I probably felt supported in the NHS. And I wanted to spend more time understanding the needs of our clients at that time. And this wasn't happening. It wasn't something I was able to do. And, you know, if I give you an example of what happened sort of just before I left the legal career was, you know, we had a client come in who had literally just been sort of abused by her partner. And I offered her literally 2 hours of my time. And once the client left, I was told I wasn't allowed to offer her as long as I did, purely because we weren't allowed to bill new clients. And that was completely against my value set and what I was raised to believe. And it wasn't something I wanted to pursue. And instead of sort of moving from firm to firm to firm, I decided, you know, I want to go out and explore my own sort of way of doing things and actually understanding a bit more about what our community needs. So I established a company called Advocate Associates for a while, which was my way of continuing my legal sort of skills, but also just sort of giving back to the community. So helping those perhaps from the BAME community who, you know, whose English wasn't sort of the first language, helping them access various services, whether it was legal services, whether it was, again, their healthcare services, and just allowing them to you know, understand you know, that how easy it was, and also just to empower them to do so. So once I sort of finished off with that, there was sort of an opportunity that came up quite close to home. So I'm a Northwest London girl, and there was an opening in the NHS for, at that time, the first pilot of integrating care. So integrated care pilot was just starting out, and this was probably around 2012. And I took the opportunity to understand what it was about. And it had all the sort of values that I really wanted to have in a job. So I applied and I got the job, and I started working in integrated care. Fast forward a few more years, my first sort of opportunity or first sort of role in the digital health space then came around 2016, 2017, when Sonia Patel, who is actually our new NHS CIO, she headed up this new digital program in Northwest London. And it was something that I had never seen. So, you know, we at that time, we didn't talk about digital. It wasn't something, you know, common to see. So I really wanted to be part of this sort of movement that we were moving to. And being a bit of a techie myself, you know, having access to a digital program in healthcare, you know, it just kind of made sense. So I applied to work with Sonia, and my first role actually under Sonia was project support. And some people may think, you know, project support is just sort of admin. It really isn't. I learned so much in that role, having to coordinate between different bodies, different organizations. It was just an eye-opener as to where we were going with this whole digital agenda. Fast forward another year or so, I then became a digital engagement lead. And what that was actually, you know, I knew that I enjoyed working with people, and I knew that digital had to play a part in this. So when the opportunity came up to help local practices become paperless or get them involved in understanding the sort of mindset change and sort of the behavior change we need to adopt in becoming paperless, I decided to then take on that role as digital engagement. And my role was really just to talk to them and make them understand, you know, what the benefits were and things like that. I then later became a product manager. So I'm going through all these various roles, understanding different aspects of digital. So, you know, start off as PSO, engagement, product manager, product owner of a patient app. And again, at this phase, there was no mention or no sort of precedent in terms of having a patient app in our area in Northwest London. So I became a product manager for that. again, product and in the NHS, roles change all the time, but sometimes your duties don't change. So it became a thing where product manager sort of turned into project manager and program manager eventually, of what we had a new program called the Digital Citizen and Innovation program. And that was huge, because now I felt like this is my opportunity to do everything I've always loved to do, and all the values that I've had is in this role, and it just makes sense for me to take this on. So I got involved with this program, and whilst I was doing this program, so whilst I was doing this role in this program, it was actually this role that I started thinking about, what else do we need? What's missing here in this digital journey that we're on. We've deployed this app. I've pretty much done what my JD or my specs told me to do. We've deployed this app, we implemented it across all sort of 8 CCG areas, but there's still something missing. We go to all these sort of engagement groups and PPGs, and all these patients are talking about, well, we don't know what a CCG is half the time. We don't know what commissioners are doing. We don't know what providers are doing. We really want to get involved. And we did a survey at that time, and actually with the sort of the role that I'm doing now with ORCHA. ORCHA was a client of Northwest London at the time, and we actually went to ORCHA and said, can we do a sort of digital attitude survey to really understand what people need in this time? We're moving pretty fast in this digital program that we're working on, but we still don't feel like we're at the point where we understand exactly what people want. So we did this attitude survey, and about 50% plus of our Northwest London residents actually said that they wanted, that they were more keen to learn about digital if someone actually showed them how to use these tools. So when I say tools, I'm talking about whether it's an app, whether it's a sort of online platform, whether it's your GP Online. So all these various digital technologies are coming out, but we're not really showing people how to use them, how to understand the ways to use them and what the benefits are. So at that time, I had an idea of actually putting together an educational program, and that educational program was not just for patients, but actually, even for our workforce. So it was sort of an open pilot that I just conducted. And I have to say, it was, the idea came from literally something that I just thought of, and it's not a new idea. I'm sure around the world, different organisations have similar sort of methods and processes around education. But in Northwest London and in the NHS, actually, I had never come across anything like an educational program to assist with digital technology or with a digital program. So I put into place a small training program, which sort of tried to encompass this idea of having digital ambassadors. So if we can get people involved and actually trained up to become these digital ambassadors within their community, then the idea is that once we train them, they'd go on to train others. And, if you think about the sort of neighbor approach, if you talk to your neighbor about something, most likely the neighbor will probably mention what you said to someone else. And it's sort of that that ripple effect of knowledge that I wanted to try and get our citizens and our sort of local community involved with. So I put out this sort of I put out this sort of advert for training, and we not only had patients come forward who really wanted to get involved in their community sort of program, but also practice managers and a few GPs who just wanted to know a bit more about all these technologies that we're coming out with. We're always pushing sort of KPIs and sort of all these programs on GP Online and EMIS and all these different things, but at the same time there's never any sort of educational component to it. How do you use them? How do you, what are the benefits to that person using this digital solution? They tend to do things as they're told, but actually if we're trying to give them a bit more information, they can probably utilize it a bit better than they are. So this digital ambassador program came up, and one of the great things at that time of when I was running that program, we sort of I applied to this to the Digital Pioneer program with Health.London, and the timing was absolutely spot on, because here I am trying to pilot a program which again hasn't been done before. There's not really a precedent for me to look at. There's nothing really that I can compare with, and it's all sort of just ideas, and it's all sort of a test bed for innovation in a sense. So this Pioneer program came at the right time, and as I went on there, my first sort of, when I had the first day of the program, I I literally, you know, I thought for a second, I don't know if I'm the right person for this. And the reason I thought that was because everyone around me had some great ideas. They brought a really cool project. Everything was a digital technology piece. It was a digital solution to something. And I just thought, this is brilliant. But my program didn't really have a digital element to it. It was just around people. And it was really around just changing behavior or equipping people with a certain mindset around digital. So I felt at one stage that, you know, it wasn't the right program for me. However, as I went on and I continued, the enormous amount of support that I got, not only from my peers that were on this program with me, but the mentors, the network that you build throughout the program, it was just absolutely exactly what I needed. And it provided me with so much confidence and so much sort of empowerment that, you know, I went on to push this whole digital citizen education program, this digital ambassador program that I was doing in Northwest London. I pushed it so much that, you know, we got to a point where we had, over 3 or 4 months, we had trained over 200 residents, 200 sort of citizens, where, you know, I don't think we would have covered that had it not been for this program. And you know, it gave me the confidence to then reach out to Good Things Foundation, and we got them involved, and they had a program around widening digital participation going on at the time, and we got the Digital Hub sort of a program involved as well. So there's all these different things that we were doing to help equip our local citizens with all this knowledge and all this training that they need to understand what digital is before they use these tools. So the Digital Pioneer program itself, you know, I have to say, throughout this whole program, I probably understood my strengths much more than I have ever had to understand. I knew exactly what I wanted to do in life. And one of my ambitions coming out of the program was actually around empowering people, especially the BAME community, who I feel need a bit more motivation, need a bit more empowerment, because due to some of, I guess, sometimes language barriers, you know, it's really hard for them to understand sometimes what we're doing, and the fear is that they can always be left behind. And, you know, following the digital program, I sort of joined forces with another fellow of mine who, you know, we both sort of co-founded this social enterprise called Project Desi. And the idea behind that is to really empower members of the BAME community and increase sort of social inclusion, so then they can be more empowered about digital. So a lot of great things came out of the program. So again, confidence, network, the mentors, understanding my own strengths. You know, I had never understood what my strengths were. The idea of collaboration, you know, collaboration became so much more easier to see. When you're working in your own sort of bubble, in your CCG or in your sort of in your organization, you don't always think about what everyone else is doing. You just kind of stick to your own, you know, your own work. Having been on the program, it's made me a bit more confident in reaching out to other organizations and actually asking, do you want to collaborate on something? Do you want to partner up with something? And most likely people will. You know, people want to help, and people don't want to duplicate, you know, efforts. So if someone's done something great, you know, let's work together and do it again somewhere else, so the end user can always benefit. I'd just like to mention, by going on the program and sort of you know, doing what I did with the ambassador training, the program itself, the Digital Citizen Education Program, it went on to win a parliamentary award for London. So we were the regional winners for London under the category of the future of the NHS. And that to me was huge recognition and sort of, you know, affirmation that actually this is something that people do want. You know, with every digital technology or with every digital program, there must be some element of education. And it's only then we can really understand what people want before we start looking at digital requirements. So in a nutshell, that's sort of my my sort of experience and my journey so far.
Sarah, amazing story. And we must get you back into the NHS or public sector again very, very soon. We can't lose talented people like you.
Oh, bless you.
Now, a couple of things that really jumped out at me from what you said. One is the importance of having sponsors or role models like Sonia Patel, because that's just so instrumental on when you're at the start of your journey, and just seeing people who forged ahead, who've got advice that they can share with you, that plays a huge role. And also the importance of networks like the Pioneer Fellowship Network, and how that's really helped to give you confidence and support and validation that you're on the right track. And also, I think the work that you've done with communities to improve digital inclusion, literacy. I mean, your passion for that is incredibly infectious. So thank you, Saira, for sharing your story. So now we're going to move to the question and answer session for all members of the panel. Now we have a question from our audience, Achala Patel for Rajal.
Okay.
How did you secure your first early adopters, Rajal, to get traction and make early revenues?
Yeah, so for us, it was talking to a lot of our networks initially. So, you know, we were focused from a not public health sector point of view, but from industry, and, you know, using our sort of solution that we've put together from an employee well-being point of view. So really it was all around, you know, reaching into our network, constantly explaining to them how we're working, and, you know, considering all the benefits, as Sara was mentioning, that, you know, how are we going to improve people's lives, and you know, taking a pilot view that, you know, if we trial it with a small group of people, does it work? You know, what do we get as feedback? And it was more around that, really. That's how we secured.
Mm-hmm. Thank you, Rajal. Now, got a question for Saira from Mo about the Digital Ambassador Program, Saira. Can you share the links for these?
Oh, unfortunately, the ambassador program was part of obviously the work that I did in Northwest London. From my understanding, I think that's unfortunately ceased to exist purely because it was underfunded, and the team sort of was, I guess, lack of funding in Northwest London sort of seized the whole digital program as it is. So I'm not too sure. I don't have any links that I can share with you. But if you do go onto the Healthier Northwest London site, there is some information of what we did, which you can look up. But unfortunately, at the moment, there's no active link or active information about it because it's not happening at the moment locally.
Right, thank you. Asha Takun wants to ask a question. How important is it to raise the importance of digital inclusion on the agenda at senior boards, particularly within NHS organisations? What are the risks if this is left out of senior discussions and strategy?
Oh gosh, yeah, this it's really important. So thanks for the question. I've always been a big ambassador or big sort of pioneer of pushing this whole digital inclusion agenda, and I honestly think that with all organisations in the NHS or any departments who are looking to put forward any sort of digital technology, always have sort of an element of education or element of the community involved. So, you know, we always talk about person-centered approach to technology, and likewise, it's so important to involve people, your end users, you know, our patients is really why we come into the NHS. And if we don't involve them from an early stage, the fear is that we'll leave them out, we'll leave out what their needs are, and we end up sort of wasting money on doing something that just won't solve the problem. So, so the risks, yeah, the risk completely. There's huge risks if we don't involve education into the agenda from the start. You know, you're going to end up leaving a lot of people behind. There's a lot of people that don't have the same skill sets as perhaps us who use Zoom every day or who use apps every day. There are people that just don't know how to download an app, and you know, it's sad that we're in this world full of technology, but a lot of people don't have that skill set, and we need to make sure that we're taking them on the journey as well. So not just people who know how to use technology, but those who are actually who actually need a helping hand. So you know, it's very, very vital that we think about things like that when we're thinking about technology or anything digital.
Yeah, I agree with that, and from my perspective, absolutely, I think it's a very vital representation that we need to have at board levels within NHS. I work with the North Central London Partnership, and within that board, around their NHS digital initiatives, they've created volunteer roles which are resident representatives. So I sit with another colleague of mine, Valerie, within that particular board for North Central London. So as a resident representative for the 5 boroughs of North London. But what we're, you know, at the moment, because of COVID, things are a bit of a standstill. But the remit of that particular role is then to get into community, to get into different community groups, to then actually talk to them about the use of digital. Exactly as you say, you know, not everyone understands what GP Online is. There's a big variety of age groups, different cultures, different languages, and actually words, you know, not people may not understand the words if it's in a leaflet, or, you know, something's been given to them in the post. So there are a whole load of, you know, I think I've seen that over the last 6 to 8 months that I've been part of that group, that these things are now starting to come into play, which is great, I think, and you know, gives us the voice as we sit at that level to say, look, there are issues that we need to actually look to address, taking it from the residents and the general public within those, you know, the areas that we all live in.
Yes, and I've seen data. We know that 20% of people over 65, for example, don't have a smartphone.
Yeah.
So instantly that creates digital exclusion and widens the digital divide to the people who perhaps need digital, you know, and support most, people who are most vulnerable. So we have to make sure that it's built into the agenda for boards and chief execs, not just IT CIOs and CCIOs, but this needs to be owned by every organization offering digital first or remote monitoring, for example.
Yes, exactly.
So we have a question from Geraldine about a survey that's currently being run by the Digital Health Network. And the survey question is going out to all senior IT leaders in the NHS. And she says, is there anything that our panel members would like to see that survey asking?
Yeah, I don't have the survey, but one of the things in all surveys going to digital leaders, in essence, I would ask for them to have some sort of voice. You know, ask the question of, do you have a voice for patients on there? So your end users, do you definitely have a voice and representation on there? Because I think the fear in the NHS is that we always make decisions without sort of the service user, and I think that's really important to ask. So yeah, I think I would say that.
Rajal, did you want to come in?
Yeah, I agree with that particular question. And, you know, I'm very passionate about the fact that, you know, we have 2 systems. You know, we've got the NHS system. At the point you've got the voice and the advocate there, you know, decisions need to be addressed, but also at the point when they get into community, because when they get into community, so we are all working towards an integrated care system and, you know, information. So how do we make sure that advocacy is there as well?
Mm-hmm. Thank you. And Geraldine, perhaps you could share the link to the survey on the chat room so that other members of the audience can also feed into this discussion. It's a really good question. Now, a question from Shamoli, I think to me, what plans are in place by the Shuri Network to engage BME groups to get into the digital space this year in terms of digital learning and working with the network to drive digital in the communities? Well, the Shuri Network, we are offering practical support. We did a members survey in April, which gave us some really good suggestions as to what our members wanted from us. And they wanted practical advice, really. We know, what is it, as a BME woman, how do I increase my visibility in the digital space? We had questions about, you know, if I'm a newbie to technology, you know, what is digital health? What does it mean? What is an EPR? What is SNOMED? So, and all the way up to people applying for the Digital Academy. how do we succeed? How do I maximize my chances of getting onto the Digital Academy for this year? So we're using the feedback that we got from our members, and we are turning that into practical support, and we're building that into our business plan. So we're developing our bursary program to help your professional and personal development. We're looking at options for mentoring. We are setting up webinars and podcasts such as this to showcase women like Rajal and Saira, and to share our stories and advice, to give you practical career advice that's more generic about how you can succeed. But we would really welcome more suggestions. So please do contact us through our website, or you can email us on shuri@nhs.net. Hope that answers the question. So I have a question for both Saira and Rajal. You're both pioneering and outstanding digital leaders and entrepreneurs, and you're also BME women. What challenges have you faced on your career and your path into digital as a BME woman? And also, what advantages has being a woman of color brought to both of you?
From my point, I think when I always look at my cultural background when I'm considering anything that I'm doing. And when I'm talking to, different groups of people, I always bear that in mind. Now, as a woman, not just in the healthcare sector, in every industry I've worked in, I've always faced a challenge and a barrier at board level. And, there's always been, I've always felt that I have to, in a way, shout a bit more or be a little bit more informed, because there is a cultural barrier. So I always feel that, we need to address that throughout, not just in our sector in health and social care, but throughout every single sector. But as an individual, the challenges were that I was always seen as the woman first. I not necessarily, my ethnicity, but, I always found that, I had to work that much harder in order to get things across and get my opinions and my passion and my change that I needed across. Coming into the health sector, taking the advantages of being the woman, I think that, my own individual persona is, I'm a carer. I'm an only child. I've been brought up with a very loving family. So my natural persona is that, I need to just make sure I'm looking after people, that they've understood something. So I think, my empathy comes across. And when I'm talking with them, because I feel that where I've grown with even the advisors that I've been around with, and my own personal friend group and my own mentors that I've also had, I've learned a lot about my own character. And, as Saira mentioned, I've learned about my own strengths, and that's how I bring that forward. And I suppose I feel that I become very confident. I'm a very confident individual, and I try to nurture that in my young, entrepreneurs or young individuals coming out of uni that are trying to think about ideas, that actually have that confidence of who you are. And I think that's the advantages I feel that I've had also from a family point of view.
Thank you. And Saira?
So challenges, actually, let me start with the advantages, or I guess the good points. So I feel like in this space, in digital health sector, we now have sort of increasingly got women sort of on leadership, leadership roles. And actually my previous managers have all been pretty much BAME women. So I've had great mentorship throughout my digital health journey. And, you know, whether it's a BAME woman or I've had BAME males as well. And it's just been great to learn from them and to really understand what they go through. And it's sort of, you know, when you have someone that you can learn from, you tend to not maybe, you know, make the same mistakes, or you look out for certain things a bit more than you would if you didn't have a role model like that. So I've been quite fortunate to have great sort of managers and BAME leaders mentoring me throughout my journey, and also with the same sort of point that Rajal made around, you know, coming from an ethnic minority background, you know, I feel like I can understand how, I guess, culture fits into a lot of these digital health requirements that we talk about all the time. You know, things like language barriers, you know, that to me is common sense. That's the first barrier that always comes to me. So I feel like coming from a BAME background has had this advantage because you see things that perhaps a lot of people might not see. So that's been great. And I feel like, I guess, throughout the journey, one of the advantages I've definitely sort of seen is I feel like I've seen a lot of gaps in the digital health space, but I've also seen a lot of strengths being from a BAME background. So that's been pretty cool. Challenges. I struggle with this one because it's hard to say if it's a challenge or not, but I think if I go with what I felt, it might come across as a challenge. So I'm someone who, and I'll probably get told off for this quite a lot, but I'm someone who doesn't see job titles. I don't really see job titles, or sometimes I don't see seniority, which is really bad. And I know the NHS is full of that, unfortunately. And you know, it's one of those things where I have felt like I'm not capable as much as I think I am, perhaps. And you know, I have been made to feel that I'm not senior enough to make huge decisions, whereas I feel like I'm more than capable of making certain decisions. And it's little things like that, you know, having to sort of prove yourself a bit more than others at times. I've come across those sort of things, and perhaps you know, the slight small challenges to me, they might not be challenges to a lot of people, but for me, I think that's been sort of my challenges.
Mm-hmm. Thank you. Now, we are running out of time. We've got about 4 minutes left. So I think we'll just have one more question, and then I'll hand back to Sarah just to tell us a little bit more about the Accelerator program. So we have a question from Megan. And the question is, do you have any tips for finding great role models and speakers from BME backgrounds for early stage entrepreneurs and clinical staff?
From my point of view, I think, you know, there are so many accelerator programs and incubators that are coming out now. They really weren't there when we were, you know, 4 or 5 years ago starting up. And, you know, I've seen over that time, there are a lot more that are coming out. And I think it's always worth, you know, having a look on the internet, what's around your local areas. There are a lot of new initiatives that are coming out. And, you know, just network and go to events, which will help you get to know lots more other people. And you, from word of mouth, you'll understand which incubators or early startup accelerator programs can actually help you. And a lot of them have, you know, event days where you get to learn about them. We did that quite a lot in our first year when we were developing our idea. We did a lot of, you know, visiting different groups, different incubators, accelerators, and, you know, we'd also gone to the DHLA one.
So I would say definitely, again, like Rajal said, social media is like my best friend at the moment. So go on to Twitter and you'll see there are so many active, you know, BAME role models out there that you can really connect with and engage with. I definitely think that's a good medium to be on, because a lot of things are happening online. And at the moment, because of COVID, obviously we can't really go to a lot of conferences and meet face to face. So being online, having a presence online would really, you know, you'll be able to connect more with those sort of leaders, I'd say.
And of course, if you need help from the Shuri Network, we do have several hundred BME women from all walks of life and all professions, including health and social care. So I've just put our email and website up. If you'd like any help finding speakers, do get in touch. So I'm going to hand back to Sarah now, just for closing remarks on the Accelerator program.
I just wanted to pick up a couple of things that have come through the messaging chat. Just as a reassurance, if you go online to the DigitalHealth.London Accelerator program, you will see that there is a discussion about closure of the Launchpad in April. That's actually the Launchpad program, which is for earlier stage companies than the Accelerator program. So don't be put off. It is still open until for the Accelerator until the 5th of July. So you'll see one for the Launchpad and one for the Accelerator. So if it's the Accelerator program, that's a little further on, and the Launchpad goes every quarter. Something picked up from the Digital Academy. If anyone is interested in applying for the Digital Academy, I'm on it at the moment, just finished cohort 2. So completely happy to support anybody when it comes to either their application or reviewing things or just giving you an overview. So please reach out to me via the DigitalHealth.London or via Twitter or any of the other ways that you can contact me. Happy for you to do so.
Fantastic.
And from the pioneers perspective, all I'm going to say is watch this space, ... There'll be some more news very soon. Okay, I've got to say a massive thanks, first of all, to Shera and the network for allowing us to work with you today to increase the amount of women and BAME individuals who are aware of the Accelerator program and the other programs that are going on. Thank you for having us. Appreciate that. Rajal, thank you for giving up your time to both support the network and the Accelerator program. I'm a little bit biased. I worked with Rajal and the whole team last year,
Yeah.
and I'm so proud to see them going from strength to strength as a company. So I'll accept the bias on that one. Saira, I loved hearing your journey and hearing about all those extra things that have happened that I never knew about you. So thank you for that. What is really obvious to me is the passion of individuals. And it's that passion that drives us and that reason for doing things the right way and for the right reasons. And what's come up also is it's not just doing things for the right reason. I came into digital healthcare because I thought it was the right thing for us to do for patients. But it was also the fact that it's the right thing for us to do together. And the support of others that's come out of this conversation and how important that support of others, no matter who you are and what you are, and how we fit into this little space, and we don't have faith in ourselves, but actually we are much bigger as that support group. The other thing that really struck me in this conversation was that eagerness to learn and find a solution to problems and how important that was to everybody. So thank you everybody for being on here today. I've really enjoyed listening to you all, and you are absolute inspirations. Thank you, ladies.
Thank you, Sarah.
Thank you.
Thank you very much.
Bye, everyone.